an annual physical, is it important? Do you really need one every year? What age do you start?
So one thing that I try to, I guess I pound my hand on the table a lot, is hopefully we will be able to move away from the term physical. When my father graduated from medical school years ago, a few decades ago, a physical exam meant that you went to the doctor and you got disrobed and they checked every nook and cranny and shook your hand and says, "You're fine, see you later, goodbye." And that doesn't necessarily translate to better health in the future. That doesn't necessarily translate to decreasing your mortality. That doesn't necessarily translate to chronic disease prevention. What is evidence-based, what is modern, is to have a conversation. Many times I have patients that come in and they're like, "Hey doc, we're not going to get into a whole thorough examination." And examination should be, and this is a personal belief, based upon symptoms. If you have a symptom and you have a concern, we're going to address it, and I may use a physical examination to help my ability to diagnose what's going on. But to bring a patient in for an annual physical and the patient feels great, "Hi doc, I'm here, I feel great, I have no symptoms," and the majority of the time is going to be doing a physical, that doesn't really benefit. So what do? What we do is we talk about different things. We talk about if your immunizations are up to date, do you smoke, what's your blood pressure, what are your numbers, what's your LDL, and all of those things.
There's no blood test, there's no urine to sample?
Yes, absolutely.
There is, okay, so all that's
typically the labs are done. Sometimes patients would like to do them before. Sometimes we do that. It depends on whether we know the patient or not and how comfortable are when you're new. You're new, so I don't like to send my patients to do labs twice.
Okay.
So when we come in, we discuss what lab tests I would like, and then sometimes, of course, a follow-up phone call and communication or a follow-up visit may be required. So again, it's often a starting point for your year.